Well, hi everyone. This is Dr. Schroder with this week's video introduction to your next course in the RN to BSN program here at Azusa. This is RNRS 358, Evidence-Based Practice. And it's very good to be with you again. The last time we saw each other was in the Foundations class, the 272 class, so I trust that everybody is well. Everybody is well acclimated and that you have found that balance between school and work and just everything that you need to do as you continue on your educational journey completing your degree. In this course, we're going to be focusing on evidence-based practice, and there's a few things to point out. Um, because of the course sequencing for your particular cohort, this particular course is coming before you take a nursing research course, which would normally be something that you would take as a prerequisite this course. Now you should have the information that you have already, although I have already posted an announcement with a link to some videos to help you with some concepts of nursing research. Nursing research is very closely tied to evidence-based practice. As a matter of fact, when we talk about evidence-based practice, what we're really talking about is how nursing research has been used to validate and to show that what we do in nursing is the best and the most effective, and that really is the most appropriate, whatever interventions we're doing, whatever things we're doing with our patients. We need to have nursing research evidence to show that that it's been validated, that it really is the best. And so the evidence-based practice process is this process of evaluating and assessing nursing research. So understanding a few concepts of nursing research is important before we start in this journey. Also, this is a writing 3 course, meaning that there is a lot of writing that will occur. You have essentially 3 rather large written assignments. The first one is going to be due in week 2. In week number 2, you're going to be talking about the library and how to find information in the library. There will be a video for you to review, and you'll be writing a paper on your strategies for finding information in the library. And then you're going to be doing an evaluation of research in week number 3, or an appraisal of research. And then in week number 4, you're going to be writing a paper on how you implement research. So we're actually combining, we've sort of shortened this class a little bit. You're still getting 3 units of content. However, you're taking that 3 units of content over 4 weeks instead of 5 weeks. So this course is 1 week shorter than you would normally expect it to be. And again, that is just kind of an anomaly with your particular cohort. We had to make some of the classes a little bit longer, some a little bit shorter, and this is one that is actually shortened up a bit. Now, I've tried to combine some of the discussion questions and combine some of the written assignments so that it hopefully will flow pretty easily. But just know that it is going to be a busy course. If you look at the syllabus, the credit hours, the number of hours per week are higher in this course than they are for the other ones. And again, that's just because of the even more compressed nature of this particular course. I just wanted to explain that from the outset. In week number 1, we're going to be talking about nursing research. And when we talk about nursing research and identifying evidence to support our nursing interventions, or what it is that we want to do, first of all, the first place you have to stop, or the first part of this process, is to identify a problem. If there's no problem that we can identify, then there really isn't any value of trying to describe or try to discuss what interventions might be appropriate or what changes might be needed. So your challenge this week is to identify one nursing care challenge you experienced in nursing school, or think of a healthcare issue you have personally experienced where critical analysis and reasoning was required to determine the best outcome. Essentially, you're going to identify a problem that you've identified or a problem that you see. You're going to locate one peer-reviewed article that addresses that problem, and then you're going to develop something called a PICO question. A PICO question or PICO statement is you're going to identify a population of interest, a proposed intervention, and then something that you are going to use to compare that intervention to determine an outcome. and a time frame over which you're going to be asking this question. So now that sounds like a lot, but really it works like this. Let's say, for example, that you have identified a problem on your unit. A very simple one would be, and this is not meant to be an example that somebody should use for this class, but just to try to describe the concept. Maybe one problem that you've identified is that you have an increase of catheterization infections, cavity infections on your unit. So that would be the problem, is that you have an increase in infection rates in the hospital. And so your population of interest in that particular case would be patients that are catheterized, that have urinary catheters. In intervention, you might find research that shows that changing catheters, or excuse me, catheter care provided on a daily basis when compared with catheter care provided every shift. In other words, you want to mess with the catheters as little as possible, will have an outcome of decreased infections when you measure that data over a period of, say, maybe 6 months. So that would be an example of a PICO statement. That's kind of what we mean by a PICO. It's you identify your population, maybe a nurse population, it may be a patient population, an intervention that you would want to implement, some new evidence-based intervention, and then you need something to compare it with. Yeah, usually that comparison is whatever that you're doing now. And then the outcome is a measurable outcome and something that you want to see occur when they're measured over a specific time frame. This is all covered in the reading this week, but I wanted to go ahead and just explain that that's what we're talking about. And this particular first week's discussion question is going to be, you're going to be developing a PICO statement. So once you review, and this is covered also a little bit in the videos that I posted. Again, the videos that I posted related to nursing research are not my own videos. These are videos that have been done by another instructor for another program, but they're kind of a quick primer. They kind of will help you answer some questions. For example, understanding the difference between qualitative and quantitative research is important. And so if you look at the Chapter 1 review for those videos that I posted, you'll get enough information to understand some of the terminology they're talking about in this class. And if you have any questions about any of the terminology or anything about what we're going to be discussing in the class, please feel free to post it in the Ask Your Instructor question box. I'll be in the class daily, participating in discussions with you, of course, and also addressing any questions. And again, I want to stress that this is going to move at a pretty fast clip. We're going to be covering a lot of information over a 4-week period. So if it feels like it's a little busier or like it's a little bit more work than you're used to, it really is. That would be a correct statement, just because of the accelerated nature of this particular class, because we're teaching it over the 4 weeks. So please review the syllabus. I will be posting the video next week as well, talking about your assignment. Please also really look forward to your week 3 and week 4, because you have a rather large assignment due in both week 3 and week 4, and where you're going to be identifying and reporting on and appraising evidence that is used in evidence-based practice. So with that, I'm just going to pray with us real quick and say, Dear Lord, thanks for bringing us together again. Thank you for bringing this class to roughly the midpoint of the program. Be with us, continue to help us to see you in the middle of the class. May you be present with us in the discussions as well as in our hearts. Thank you for all you do, Lord, and we look forward to serving you as we continue to grow along this journey. As we pray in your holy name, amen. And with that, I'll say amen. I look forward to seeing you in the discussion forums. Please see that there is also, one thing I forgot to mention is that you will also have a spiritual or a weekly journal, week reflection is due week as well. Remember, this is a writing course, so you are going to be graded on your writing skill, and that the writing prompts and that the writing requirements for this course are a little bit, well, they're going to be more a focal part of this course. than some of your other courses because, again, it is an intensive writing course. This is one of two courses in the program that are identified as that intensive writing course. The first one you had was nursing theory, and this is your second one. So I look forward to participating in the class with you. I look forward to answering any questions, sharing my knowledge, and once again, getting acquainted with everybody. So I look forward to seeing you in the discussion forums.